Hello, good evening, everyone. Today with me, I have a young and dynamic IPS officer of the 2019 batch, Mr. Rohan Jagadeesh, who is the Deputy Commissioner of Police, Law and Order, Belagavi. He's earlier served as the Deputy SP for Sagar Subdivision of Shimoga District. A warm welcome to you, Mr. Rohan.
Good evening to everybody and good evening, Kiran. It's
Rohan, your voice is not audible.
Good evening. Can you hear me? Can you hear me? Hello? Can you hear me now? Hello? Can you hear me?
Just a minute. Yes. Hello?
Yeah. Can you hear me now?
Yeah, I can hear you. Yeah, I can hear you now.
Yeah. So, good evening to everyone. Good evening to all the viewers of All About Belgavi and to Kiran for hosting this show, which is so important at this time of the year and at this time for all the youth and for all the parents and all the guardians out there for whom the understanding of drugs and its effect on the youth is important. I would be able to converse with you in both English and Kannada. So, whatever is useful for the audience, I would like to go ahead with that language. So, Kiran,
Yes, go both.
ಓಕೆ
Yeah.
ಸೊ ಎಲ್ಲರಿಗೂ ನನ್ನ ನಮಸ್ಕಾರ. ಈ ದಿನ ನಾವು ನಿಮ್ಮೆಲ್ಲರಿಗೂ ಈ ಮಾದಕ ವಸ್ತು ಮತ್ತೆ ಅದ್ರದ್ದು ದುಷ್ಪರಿಣಾಮ ಯಾವ ರೀತಿ ಆಗುತ್ತೆ ನಮ್ಮ ಯುವಕರ ಮೇಲೆ ಅಂತ ಹೇಳಿ ಒಂದು ಸಣ್ಣ ಪ್ರೆಸೆಂಟೇಶನ್ ಮಾಡಿದೀವಿ. ಮತ್ತೆ ಕಿರಣ್ ಅವರು ನಮಗೆ ಈ ಆನ್ಲೈನ್ ಮಾಧ್ಯಮದ ಮುಖಾಂತರ ಎಲ್ಲರಿಗೂ ಒಂದು ಅವೇರ್ನೆಸ್ ಪ್ರೋಗ್ರಾಮ್ ಮಾಡಿಸೋಣ, ಹೆಚ್ಚಿನ ಜನಕ್ಕೆ ಉಪಯೋಗ ಆಗುತ್ತೆ ಅಂತ ಹೇಳಿದಕ್ಕೆ ನಾವು ಇದೊಂದು ಮಾಧ್ಯಮನ ಆಯ್ಕೆ ಮಾಡ್ಕೊಂಡಿದೀವಿ. ಸೊ ಒಂದು ಶಾರ್ಟ್ ಟಿಪ್ಸ್ ಇದೆ, ಆ PPT ಪ್ರಕಾರ ನಾವು ಓಡಿಸಿದಾಗ ತಮ್ಮೆಲ್ಲರಿಗೂ ಒಂದು ಸ್ಮಾಲ್ ಎಕ್ಸ್ಪ್ಲನೇಷನ್ ಕೊಡ್ತೀವಿ. ಅಂಡ್ ಕಿರಣ್ ಇಸ್ ಆಲ್ಸೋ ಟೋಲ್ಡ್ ಅಸ್ ದಟ್ ಒಂದು ಸೈಕಾಲಜಿಸ್ಟ್ ವಿಲ್ ಆಲ್ಸೋ ಬಿ ಜಾಯ್ನಿಂಗ್ ಅಸ್ ಟುಡೇ, ವಿಲ್ ಆಲ್ಸೋ ಎಕ್ಸ್ಪ್ಲೇನ್ ದಿ ಎಫೆಕ್ಟ್ಸ್ ದಟ್ ಡ್ರಗ್ಸ್ ವಿಲ್ ಹ್ಯಾವ್ ಆನ್ ಯು. ಸೊ ವೆನ್ ಹಿ ಜಾಯ್ನ್ಸ್ ವಿಲ್ ಟೇಕ್ ದಟ್ ಫಾರ್ವರ್ಡ್ ಟು. ಸೊ ಕಿರಣ್, ಲೆಟ್ಸ್ ಗೋ ಆನ್ ಟು ದ ನೆಕ್ಸ್ಟ್ ಸ್ಲೈಡ್.
Yes.
Okay, so it's a short quote over here. So it says that reject anything which is a poison to you, which makes you weak physically, intellectually, or even spiritually. So the thing with drugs is it not only makes you weak, physically, but also it deteriorates you intellectually and spiritually. So please don't, go forward with drugs. Next. Okay, so like you're seeing over here, India faces about 10 suicides every day due to the abuse of drugs. And there are almost 7.5 crore drug abusers in India. And heroin is one of the busiest drugs with over 6 kg of it being sneaked into India. So the alarming magnitude of this problem is phenomenal. And like you can see, most of you all must have watched movies like Urta Punjab or any of these other movies wherein you've seen Punjab is largely affected. That's because of the geography in which Punjab is situated. Towards the left of Punjab is the Golden Triangle and to the right is the Silver Crescent. So a lot of smuggling happens, so because of which this problem is. And like you can see, Afghanistan and Pakistan, which are porous borders, although it's fortified, like the border is in a structure wherein smuggling happens. So the problem persists over there. And it's very alarming. ತುಂಬಾ ಬಹಳ ಒಂದು ವಿಷಯ ಏನು ಅಂತ ಹೇಳಿದ್ರೆ 16 ವರ್ಷಕ್ಕಿಂತ ಕೆಳಗಡೆ ಇರೋ ಬಹಳಷ್ಟು ಜನ ಈ ಡ್ರಗ್ ಅಬ್ಯೂಸರ್ಸ್ ಆಗಿರ್ತಾರೆ. ಸೊ ಎವ್ರಿ 4 out of 10 and every 2 out of 10 ಅಂತ ಹೇಳಿ ಇನ್ನೊಂದು ಸ್ಟ್ಯಾಟ್ಸ್ ಇದೆ. ಸೊ ಅದೊಂದು ಗಮನದಲ್ಲಿ ಇಟ್ಕೊಬೇಕಾಗುತ್ತೆ. ನೆಕ್ಸ್ಟ್. Okay, so we've already touched, heroin is one of the largest consumed drugs in South Asia, and the business of which is about 20 lakh crores a year. So the magnitude of this problem is very high. So like you can see over here, there are several classes of drugs mentioned over here. So we'll take you through every one of them. The first one that you can see over here is opium. Next to that is heroin. Then there's brown sugar. Then there's morphine. Then there's cannabis, which is also otherwise locally called ganja. Then there's hashish, then there's bhang, which is sometimes used recreationally even in festivals, which is also illegal. And there's LSD. Then again, several accepted and abused drugs like tobacco, then caffeine, which comes in the form of, even in common things like coffee or Red Bull, and you have your nicotine, which is in your cigarettes, and also this other psychotropic substance like ecstasy. These are types of drugs that are commonly found around the world. Okay, Now, if you see over here, you'll notice there are common forms of administration of drugs, things to be watched out for, especially for older people or for parents to see, any of these behaviors. One, you can take it orally. Second, it's by inhalation. Third is by injection. Fourth is chased. Then it's snorted, and next is smoked. So, ಇಲ್ಲಿ ಎಲ್ಲ pictographic depiction ಅಲ್ಲಿ ಇದೆ. So, ಇದ್ರದ್ದು ಅರ್ಥ ಮಾಡ್ಕೊಳ್ಳೋದು ಬಹಳ ಇದು. So next, we'll just run you through the different forms. One is ganja, which most of you all must be aware of. This is either consumed orally or it is smoked. So it grows in a plant, which you can see over here. So a cultivation madi, then they dry it and they make a powder out of it, and then it is consumed or smoked. So this is one form. The next one that comes is a derivative of ganja, which is like hashish, charas, or bhang. This is mixed with some form of juice or pakoda or halwa, and it's used in some festivals. So because of which that is also there. And the next one that we have to see over here is the effects of ganja or marijuana on the youth. One is they have an anxiety or paranoia, coordination problems. I think our doctor over here can touch upon some of these symptoms so that it benefits the audience.
Good evening, Doctor. Warmly welcome Dr. Chandrashekhar TR, MBBS MD Psychiatry, Consulting Neuropsychiatrist and Associate Professor of BIMS College, Belagavi. Thank you for joining us, Doctor.
Thank you. Thank you.
Yes. Doctor, now we are seeing, there's a form of signs and symptoms of its addiction. Like
Yes.
as Sir mentioned, there's a loss of control, anxiety and paranoia. There's a coordination problem, disordered. So what kind of patients do you get usually, doctor?
So usually I am seeing youngsters, especially in the range of 15 to 25 years of people. I am getting more who are addicted to ganja or charas or heroin. And that is already it is mentioned in the PPT. That is how to identify. That is usually these people will have red eyes, and actually they will have dryness of mouth, increased perspiration, that is increased sweating, and they will be restless, they will be irritable, and they will have coordination difficulty, tremors, all these things. So by looking at all these things, that is we will diagnose whether it is dependence or withdrawal.
Doctor, what are the primary psychological factors that contribute to teenage drug abuse?
So especially youngsters, that is first thing is curiosity. Out of curiosity, that is they will start first. Once they start, that is they cannot leave because of drug addiction potential. They will be involved in the repeated use and they will become addicted. And second one is peer pressure. That is commonly nowadays, that is everybody will go for parties. So when they go for parties, they will, that is friends will force them to use the drugs. It may be alcohol, it may be charas, it may be ganja, it may be heroin, it may be MDMA. So it is out of peer pressure, because of friends' pressure, they will start and they will become dependent. And next this thing is stress, psychological stress. Everybody will have stress. It may be failure in exams, or it may be failure of love. So because of all these stress factors, to relieve stress or get rid of stress, they will start using these drugs. And it may be pleasure seeking also. Sometimes it gives pleasure to some people, and because of pleasure, they will go on increasing the quantity and repeated using, they will become addicted.
Yes, thank you, doctor. As Rohan has joined us back again, Rohan.
Can you hear me now?
Yeah, I can hear you.
Yeah, so I heard a few things that doctor was touching upon. So as doctor was rightly saying, a lot of factors such as peer pressure is pertinently important that we have to address, because apparently these days doing certain things which are illegal like this is thought to be cool by a lot of students in college and otherwise. So such things should be highly disregarded, because none of these activities whatsoever makes you a bigger person or a cooler person or a posher person. It just makes you get very messed up in your life. So people should really avoid it. So now moving on, let's go to the next one. Now it's opium. It's a derivative form of drug, and through this they also, things like heroin, white sugar or brown sugar, whatever you call it, is also made. This is a very potent and addictive drug. Okay, next. Okay, so now, like we already touched upon this, heroin is one of the largest abused drugs in South Asia, and the business of which runs into 20 lakh crores. Okay, now signs of heroin abuse. You have things like paraphernalia, like you can see things like spoons. So basically, you're supposed to put it on a spoon, light a lighter underneath it, and the fumes will start coming. So you can see burnt spoons, and then you can see syringes, which is a form of usage by injection. Then you have rubber tubing, and then you have white powdery residue. The appearance of people normally engaged in this thing. Okay, so the pupils will start becoming tiny. They'll have sleepy eyes. They'll have slow breathing, flushed skin, and runny nose. So these are all watch out signs which most people should be aware of. And some of the actions that these things will also bring forth is vomiting. Like you can see a lot of scratching, slurred speech. They complain of constipation, nausea. You see, even their outlook, their way, like how do you see a normal person? He'll be well groomed, good haircut. He would have gotten his shave. He dresses well. He's clean. But this thing is neglected because he's in a sense of daze, paraphernalia. He's disoriented. So such things happen. So then second, and mostly his appetite starts coming down and he'll start losing weight. So these are some things you have to notice. And also look at the last point, covering arms with long sleeves. If somebody understands why this happens, it's because for a person who periodically uses it, there'll be a lot of injection marks on his veins, especially on just
Exactly.
below his his biceps. So these things, because if you keep pricking yourself, there'll be a lot of marks, and after a while, it starts caving because of the wound, and then it will appear. So that's why this covering will happen. So these are telltale signs which people should watch out for.
This is the most important part of this slide, I believe, where parents can come to know if these signs are there, they should watch their kids very carefully.
Yeah. No, we have a slide in this in the end which talks about how parents can identify. It's not really very, very difficult. Like, for example, a boy who's grown up with you for 16 years will have a certain kind of behavior, and you know what is normal. Whenever you have an intuition that something is abnormal, that is the first telltale sign. Because with any of these psychotropic substances, there's two ways which will affect you. One, it'll make you high. Second, it will make you low. So depending on the class of drug and the type of drug, whether it's chemical or or a plant derivative, it has different types of properties. So your whole behavior will change. People will start becoming lonely, quiet, or highly eccentric, or highly active, or long nights, displaced behavior, change in friend circle, anger issues at home. So many different kinds of things happen. So in this, even one thing in this, you should watch out for. Even in the small thing, you should not neglect them. And as soon as you should either take them to a de-addiction center, or you should take them to a laboratory, get them tested for something, or take them to an internal medicine doctor, because they can always suggest, and then take them to a psychologist who can give them some form of help. Like what I've come to understand is when you take these drugs, the capacity of your brain to produce dopamine on its own starts reducing. So to bridge the deficit, you have to take more drugs. It's like probably like taking a sugar tablet. You keep taking a sugar tablet, and then it controls your sugar, but then you become dependent on it. Then you get adjusted to the dosage. Then you have to take more. It's like insulin and sugar tablet. So basically, coping mechanism will be to bring back the dopamine. I'm not exactly sure of the medical science. A doctor can tell us better, but this is the logic. It's a cyclical thing which if you don't address, will take you into doom. So that's the logic.
Shall we go to the next slide?
So the next one is cocaine. So the street names of this is called crack, or coke, or snowbird or nose candy. Like you can see over here, what happens is it's like a white powder. It could look anything like powdered sugar or salt, and like it's available in grams, and a small gram costs quite a lot of money. So in this, it's mostly used in the form of inhalation. So what they do is they use a note like this, which you can see, and then they make a line out of it, and then they snort it. So very, very potent drug. So please watch out for these things. Next. Okay. Like over here, as you can see, signs of cocaine abuse. Okay, one of the things is for any drug which uses an injection, you all know there's a lot of bloodborne diseases which could, affect you, like all your hepatitis, your HIV infection, or any other, bloodborne disease. Next is you have problems like nosebleeds, and you have cardiovascular issues, attention span is altered, then sleep pattern, respiratory illnesses, and, weight loss, and eventually death. A doctor, if you could highlight a little bit about what could happen because of these things, it would be very beneficial for people.
Yes, doctor.
Yeah,
Hello.
because of cocaine, even heroin, all these things, that is, they will have respiratory infections. And initially, they will have severe cough with expectoration. And usually, what happens, that is, blood pressure initially goes up, but for youngsters, it is not a much this thing. But they will have isolated behavior. They will be separated from the group, and usually they will become more irritable during the intoxication, or during the period of withdrawal. They can become intoxicated, irritable, and usually they will get separated from the family, friends, and there may be memory losses. And some people will have aggressive episodes. They will become very aggressive, severe hallucinations, delusions may be there. That is, hallucinations are without any stimulation. They will see the things, they will hear the things, they will feel the touch. That is called hallucinations. Delusions are, they will feel that paranoia. Somebody is planning against me. Like that, they will plan, they will think, and they will act. Usually, they will go into crimes, all these things, because of this cocaine or ganja or heroin, all these things. So, majority of the times, police will see crimes under the influence of all these drugs.
Okay.
Yes, Rohan.
So the good part about all of this is in Belgaum city, of course, we don't really have any of these problems, but this is an understanding for all parents out there that these are telltale signs to watch out for. Maybe your child could be studying in another place or another state or somewhere, and if there's ever an indication, these are things to watch out for. So
No, sir,
let's go
it's
to the
a
next
burning
one.
problem nowadays. Nowadays, it's a burning problem. That brown sugar and heroin, that is 15 years back, it was not there. Now, it's a burning problem. There are many youngsters.
No, whatever it is, I'm saying like the magnitude of the problem for us is not more. It could be more in other cities. So the only indication of this thing is that people should know. Like over here, there are so many
Yeah.
types of psychotropic substances which are very hard to come by, very hard to get. So it's more. The more you know, the better you learn. So I think that's the important take-home lesson over here. We'll go to the next one, like a hallucinogen. Like you have LSD. So these are basically, like you can see, the small stamps which they put on the tongue, and then these things melt in your mouth, and then they, cause a lot of problem. Like if you see in the slide also, these are very rarely available in India. But at the same time, if you see things like these stamps with little bunnies on them or little animals on them, which normally don't otherwise look like a regular postal stamp, then these are things you should watch out for. These things again alter your brain in very different ways. Next one. Okay. So now, of course, you have your alcohol. Alcohol also is in its own way an addictive substance, and this could also have effects which are again over here. It could also lead to things like alcoholism abuse and effects on your kidney, livers, your family, and all those things. So please watch out for alcohol too. Don't take it too lightly. Okay. Now let's move on to another thing, which is normally abuse. So this is this is more prevalent among very poorer sections of the society. So you have things like solvents, thinners, and whiteners, and all of that, which could also be used as a drug. Like they'll use this, then they'll fume it up, and the fumes will start coming, which people ingest, and it also gives them a certain kind of high. The problem with such things is it's so easily available in any store, so anybody could abuse it, and you would not know. But if you see people, especially people who are working in your neighborhood or abusing such things, so please get them help. inform the police too, so we'll take some action. Now, next, this is another thing called date rape drugs. So, what happens with such things is whenever people, when people go to a different city and they go to different places, meet people they don't know, somebody could slip something into your juice or your this thing, and then they could take advantage of you. So, the thumb of rule is don't meet anybody that you don't know, don't meet anybody that you haven't met, don't meet anybody that you haven't seen physically. And third is whenever you go out, please go out in groups and don't accept any food or drinks from strangers. So by following these simple steps, you can save yourself from such things. Next one. Okay. So now with drugs, what happens is a lot of withdrawal symptoms. Without using them, there'll be a lot of issue. And like I was saying, your dopamine level, if you don't have your feel good hormones coming into you, then living normally would be very difficult. So you would need to keep increasing your load in such a way that you feel better. So these are the withdrawal things, and things like your hands tremor, you get shaky, you get irritable, you have depression, you feel isolated, and then you have insomnia, which is basically you will not be able to sleep. Then you can see that your palms are very sweaty, your heart has palpitations, and then which means like you will feel like nan hridaya bala odkontiದೆ ಜೋರಾಗಿ, so this kind of thing. And then you have tremors in your hands and all those things. So these are some of the withdrawal symptoms. Next. Okay. So indicators of drug addiction, some of the basic ones: weight loss, malnutrition, needle marks, and then runny nose, drowsiness, dull looking, tremors. Anything that makes a person look less normal than he normally should appear. There should be a reason. If a person is looking like this, one, you know that he is medically ill. For that, you would have gone to a doctor. He'll be taking some form of treatment, so that Second is it's just gradual. It happens over a period of time, and then you just don't know what hit you. So that time you should watch out for it. Next, you have behavioral symptoms like doctors are saying: lack of motivation. You're very argumentative. You become aggressive, solitary behavior. You start lying. Sudden request for money because you need some kind of money, right, to buy these things. So that you start stealing also because you need money to buy drugs, and then changes in speech or withdrawal symptoms. So these kind of things happen. Next. Okay. And then students, same things, but they'll lose interest in school, become moody, change their friends, get into fights. They lose interest in class. A good student may become a bad student in terms of his marks and otherwise. So these are a few things. Okay, risk factors, doctor would be able to say better, but some of the basic things is a lot of children may have issues with respect to maybe bodily issues or body shaming or rejection or peer pressure, or they'll be emotionally vulnerable, come from rejected families, or come from these kind of homes. And another very important factor over here that they've rightly put is curiosity. So everybody wants to know what they have never tried. It's like probably doing bungee jumping, and nobody does it continuously, but one time everybody wants to try. But the problem with this is you try once, then it becomes a habit. So the better thing with these kind of things is never try, because you're not losing out on anything by not trying. And like 99% of the society will never try it, and it is not. It is absolutely unnecessary, and most important, it is illegal. So don't try it and don't get into trouble. That's what I would like to say. Next. Okay, we'll go to the next one. Next one.
Yeah.
Okay, so some of the things that people have to understand. So if a person is caught with drugs, what happens? Doctor, can you please speak for a minute? I'm getting a call.
Doctor, how does environmental factors such as family dynamics and peer pressure influence a teen's likelihood to engage in drug use?
Yeah, usually that is single parenting. Majority of the times we will see single parenting is the main cause for these drug addicts, and loss of prominent figure in the family. Suppose a father is got transferred, he is working in military or some other bank or this thing. That is, if they are not there, only if they grow with the grandmother or mother, usually they will get into all these things. And isolated families, That is, some families, they will shift from some states to other states, and usually they will not have friends. In that case, because of friendship, they will get into all these things. See, these are the, and another thing is criticism. If you are not using the substance, and they will start criticizing him, and because of criticism, he will start using, even though he is not interested, he will start using. And too much of restriction in the family, or too much of liberalization in the family, all these things are the factors which are affecting on the uh, environmental factors.
Doctor, how significant is the impact of mental health issues such as depression and anxiety on teenage drug abuse? होता क्या है actually, doctor, इसमें?
Yeah, that's what nowadays, that is, we are seeing nearly, according to WHO, nearly 16 crores of Indian people are using alcohol. 16 crores. That is, we are 140. That is, nearly, it is 15% of the people are using the alcohol. And cannabis is about 3.1 crore. And opioid is 2 to 3 crores people are using. Inhalants about nearly 1 crore. That is, 80 lakh people are using in India. That is according to the WHO. It may be, that is, sometimes that is not taken for accountability. So these are the reasons. That is, nowadays it is increasing. Trend is increasing. That is, use of cannabis, even opioid. Everything is increasing.
Doctor, what are the common signs and symptoms that might indicate a teenager is using drugs, which is very important for a parent to find out?
Yeah, usually that is when they start using the drug, they will be separated from the family. All these years, he was very close to the mother or father. Usually, they will get separated from the parents and isolate. This isolation, that is, in that case, they have to observe for the any drug abuse or anything. And usually, these people will have decreased appetite, decreased sleep, and increased friendship. That is, always they will be outside only. In that case, you should be very careful, and with
What
whom
kind
they are
of
going.
what kind of circle his friends are and what kind of people he's hanging around with?
Yes, with whom he is going. So you should keep a watch. And it is usually these people will have redness of eyes and repeated cough and repeated irritability. And because of irritability, they will destroy the things, household things. So in that case, very silent boy, when he becomes any behavioral changes, you have to note down, is there any cause?
Doctor, how can parents and educators effectively identify at-risk teens before drug use begins?
That is, I told you, no, that is, it is not only parents, this thing, when they go for college, that is usually in college, that is college or this thing, even in our medical colleges, we have made mentors. 10 people, we have made mentors. Our all teaching faculty will become mentors, and they will be observing the students, whether they are attending the classes regularly, whether what they are doing, whether they are studying properly or not, what is their performance. So by observing all these things, they can maintain this, whether they are having any problem or not.
Okay, doctor. That's actually a nice thing to do, doctor. What are the most effective preventive measures to reduce drug use among teenagers?
Yeah, that is majority of the time. That is, we will see uh, people have the myth that is alcohol or any drug should not be stopped suddenly. So it should be stopped suddenly. Then only, that is, these people will stop. So usually,
Yeah,
majority
hi.
of the time, parents, they are saying that alcohol should be reduced in quantity. If they are taking 4 bottles, it should be made into 3, 2, like that, tapering dose. It is not advisable. That is, abstinence means complete abstinence. Then only, that is, initially 1 week, 3, 4 days, or 1 week, they can have withdrawal symptoms. After that, withdrawal will go off.
So, Rohan, how do you all handle when you threshold of a drug addict or anything like that, because
Yeah,
this is not.
initially that is when they are
So
abstinent, if that is usually they will have initial higher levels of neurochemicals in the brain. So instead of drugs, we will replace them with the drugs. That is, benzodiazepines are there, antipsychotics are there. There are so many other drugs which will replace the substance. So
Okay.
initially we will treat them with drugs, then gradually we will taper them.
Thank you, doctor. Thank you.
So with us, what generally happens is we get information. When we get information, we take action by catching the person who's selling or the person who's consuming. So this year also we've done several cases, and then they get booked under the NDPS Act. And once they get booked, then we have to arrest them. So this is what we do. And then once we arrest them, then it is a very strict legislation, so it would affect them, or any students also getting caught in it will be affected by it. So our advice, sincere advice is, don't engage in it, or don't let anybody influence you to engage in it. And if you know somebody who's doing it, please let us know, because the most important thing is the police cannot be present in every single place at every single time. We do have a number called 112. Anybody is free to dial it on their mobile phone, and do let us know if somebody is selling somewhere, or somebody is buying somewhere, or if you notice any of your friends or families. Even our doctor here, if he has any patient, can also tell us that this kind of thing happened, and will not really tell anybody about it. And also, all the information given to us will be kept secret. So it is our request to tell us, and whenever we get information, we will definitely follow up and do cases. So as you can see, the punishment ranges from 6 months to 14 years. It has rigorous imprisonment, and the fine is up to 2 lakh rupees. So please don't engage in any of these things. And then,
Exactly, sir. Exactly. That is only law cannot do anything or police cannot do anything. It's a teamwork. Even health workers,
It's a
even
collective responsibility of every
social
citizen.
workers,
yeah.
social
So, like
workers.
Dr. was saying, all of us should join hands together, because whenever we join hands, because public move around more in spaces at every point of time, they know what is happening in their gully, what is happening around here. Of course, we also have our people who go on beats and everything, but at the same time, always the number of public is more than the number of police. So anybody in this Belagavi taluk who can give us any information, we will definitely take action. And luckily, we've been able to curb this menace to a large extent by the efforts of a lot of police and a lot of public. But we are definitely keen on doing more action with valuable information that is given to us. So we request everybody to give us information.
So Rohan, I know a drug peddler. Who should I report this to? What is the
Just
procedure?
call
Because I understand
112.
you are busy now, so I'll quickly
Just
finish
call
up with
112.
this. Yeah.
Just anybody can just call 112. That's
Okay.
all. You call 112, there's a toll free number, there's a person who will pick up the call, and then you just tell him, like, let's say, into Jagdalli, Intoru, Itara Yadu, Namge Samshayavagide, I'm suspicious that he might be selling drugs. That's all we need. We don't need, and exactly at what time. Our response time in the city is less than 10 minutes, in Market Subdivision, Kade Bazar Subdivision. So our vehicle will reach there. If there's a person there, we will pick him up, and then we will check if he has anything, and based on which we will take a case, and we will, we'll arrest him if he has on him in his possession. And then we can also check other. We can check technical evidence, and then we can see with whom he bought from and all. But the most important thing is, please register cases, because such cases we keep checking our logs. If we've gotten any information of that, and we don't really get any information like this, like nobody calls and tells. And the good thing about 112 is you don't even have to tell your name. So you can always call and say, I want to keep my information anonymous. ಗುಪ್ತವಾಗಿ ಇಡಬೇಕು ಅಂತ ಹೇಳಿದ್ರೆ your name also need not be given, and we don't even require your name. So we'll check. If you find it, we'll catch you.
Majority
Rohan,
of the
apart
people
from
worry
this,
about that, sir. Anonymity.
yeah,
Majority of the people, their fear of having that, that is my name will be exposed, and that is who has called the police, all those things. Majority of the time they are worried about their identity. So because of that only they will not inform.
Yeah, but in this you don't have to give your name. Nobody will ask you. Or let's say, for example, your name is Rahul. Say your name is Ravi, as if anybody can check. It doesn't make a difference. All we need is your information. And once you give your information, we'll check. If he's there, we'll catch him. If he's not there, then there's no problem. Simple.
Rohan, see, apart from what you all are doing, a lot of awarenesses in schools, colleges, and a lot of the efforts have been put by the police department to curb this issue. What is more expected? Like, are you all doing it, engaging into a citizen program, like something like that? Like, you have any particular areas where you get engaged with the citizen? Do you have something like that?
So we have beat constables in every police station, and they run their own beats. So beat is the whole area of a police station is divided into beats. So when they go to their beats, they have citizen members who are part of those beat groups. And when they go there, they talk to people, 50 people, 100 people. And when they're talking over there, they do give them awareness, and they do tell them everybody has the beat officer's number. And as you know, these days, every police officer's number in Belgaum city, everybody knows. So anybody can pick up the call and call anybody. The WhatsApp is there for everybody. And it's as simple. You're going in an area, you see something, drop a location, and you say, I'm suspicious of this. Like, you don't even have to put your name and WhatsApp. So, these kind of things, everybody knows what to do. We just have to take some initiative. And only when we take initiative, we'll be able to. So, anyway, I have to rush, but...
Yes. Thank you, Rohan, for giving us such a valuable time talking to us. Thank you so much.
This last slide is very nice. Okay, I'd like to finish with this. See, you have to choose your side. Whether one side is addiction, there's a branch without any leaves or any flowers or it's lifeless. On the second side, there's life, which is so beautiful. So you have to choose, life. And I'm sure that in our city, 99.99999% of the people will always choose life, and the rest 0.00001% just need help. And if there's anybody, please let us know. Refer them to any doctor, to a Dr. Chandrashekhar. They can always help them. And a lot of us are willing to do pro bono effort to make our city a better place. So we'll do our best.
As a young officer, Rohan, what is your take? Like, you've been into your school life, college life. You've been a good swimmer also.
My thing is very simple. When we are young, when we were young, all of us are curious to know, experiment and all of those things. But we should be aware of what our limitation is, what we should do and what we shouldn't do. Nobody should police us. We should police ourselves first. And when we police ourselves, half the problem is solved. And secondly, I feel we all come from a family. We want to give our parents a good name. We want to do something in society. We want to build a name for ourselves. We have to work hard, because none of us are born with a golden spoon in our mouth or anything. So every day we have to work hard to, feed our own selves, our own family and everything. So to do that, we have to make a name for ourselves. And I also personally believe that students should play a lot of sports. When they play a lot of sports and engage in physical activities, then that is a different form of high altogether, which you get from playing sports. Team games especially, you should sweat a lot by playing sports. When you do such things, your mind is always active, and you'll be, at the end of the day, you'll study, you'll play sports, you're really tired. The last thing you want to do in a day is just sleep. So if you do this, your life will be very beautiful. And once you, have a particular standing in life, and you earn your own money and you have your own family, you'll not want to do any of these things, because then you'll be responsible. So you just have to wait for the right time. There's a right time for everything. And but let me remind you, for drugs, there's never a right time, so never indulge in it. And always be mindful, be watchful, and be eventful, and make your life successful. So thank you.
Thank you so much, and thanks to Chandrashekhar for giving us such a beautiful presentation. Thank you so much, Rohan. We'll see you soon again.
Thank you. Thank you, Doctor. Nice talking to you.
Thank you.
Yeah.
Thank you.
Doctor, how can parents best approach the subject of drug use with their teens to foster open and honest communication?
Pardon, once again?
How can parents best approach the subject of drug use with their teens to foster open and honest communication?
That is nowadays media is accessible for everybody. Even if you go to the village, even any remote area, that is media is available. It may be YouTube. That is I have seen even village people watching videos or YouTube. And usually it is not only uh, celebrities. So many people will have, they will tell their experiences, bad experiences, good experience about the use of drug or any other things. So it is usually what we have seen earlier, only models they used to, that is people used to follow models. Nowadays, that is in YouTube, that is not only models, everybody, that is they can follow everybody. And that is all these videos, observing, after observing all these videos, they will get into drugs out of curiosity or out of frustration, out of stress, all these things.
Doctor, what are the treatment approaches for teens who are already struggling with drug abuse? This is the most common factor, where parents struggle with children are
Yeah.
who into it.
First thing is, I told you, sir, first thing is abstinence. They should be out of that environment or out of the drug. So if they don't come out of that drug or small quantities if they are consuming, that is, they will not come out of that withdrawal symptoms. Continuously, they will have withdrawal symptoms. And initially, that is after stopping the drug or any substance, that is usually we will give some benzodiazepines, antipsychotics to control their symptoms. It may be autonomic symptoms, sweating, or tremors, or disturbed sleep, or any irritability. So initially we will give medications. Once they are stable, that is we will stop or we will taper and stop. That is our treatment approach. And once they are out of withdrawal, that is we will start doing the group therapies. Group therapies, that is 10 people are there. Usually all 10 people will have different experiences of withdrawal, how they left the drug, all those things. That is, they will share their experiences. That is called group therapy. And usually that is spiritual therapy also. Sometimes they will be getting into the bhajanas or any other puja or any other recreational activities. And usually that is the uh, group therapy sessions. And ultimately that is, suppose a person is stopped alcohol and he will tell his experiences and he will become the group leader. That is called Alcoholic Anonymous or Narcotic Drug Anonymous. They will make their own groups and they will tell their experiences. And these things are very helpful. They are not professionals. They are the earlier drug addicts. And once they are very severe drug addicts, after that they will stop and they will become the leaders of the group.
That's a nice thing, Doctor.
Yes.
Doctor, how can relapses be prevented and managed in teen drug abuse recovery programs?
See,
Like you have small numbers, you have
relapses are very common in drug addicts. Usually 3 months, 6 months they will leave, and whenever there is a stressful situation, again they will start using that. So that is relapse is very common, and that is usually doctors or any de-addiction center people should not become anger with these people, but that is usually they will be admitted and they will be treated in the same form. That is, it may be third time, fourth time, fifth time. So that is when you start doing treatment or when you go on treating the patients, they will stop it. One day they will stop it.
how does social media and online cultures contribute to the rise in drug abuse among teens? Like, we've come across any case like that, Doctor?
No, that is it's not like that. But that is usually we will see gutka and all. Gutka, that is majority of the times in the TV they will show. That is all
Yes.
celebrities, Shah Rukh Khan, so many they will advertise for gutka, and these people will get, that is they will not show any hazardous effect, and even if there is a hazardous effect it will come in the small letters, so they will not show that side effects prominently.
That's true. What recent research findings have been found most significant in understanding teenage drug abuse?
So one this thing is so majority of the times we are seeing because of peer pressure only, and second one is curiosity, and out of frustration, that is stress. It may be nowadays we are seeing so many people getting involved in a relationship. When they break the relationship, that is they will start using all these things, or it may be failure in exams or failure in anything. Suppose he is a sportsman, if he is not able to qualify in sports, he can get into that, or any other things. It may be because of pleasure they are taking, it may be because of stress they are taking. Once they start taking this, they will not leave it, they will become addicted.
So basically the rejection, how they take is more important.
Yes.
How they handle rejections is more important.
Well, majority of the times, adolescent depression, that is, these are the psychiatric causes. Depression is very common, anxiety is very common. And usually, what happens once they drink alcohol or any substance, that anxiety will go off. They will
Correct.
become relieved of all these symptoms. And to repeated anxiety, to relieve anxiety, they will start using that.
Doctor, how have there been noticeable trends or changes in teenage drug use pattern in recent years? If so, what are there? Like you've been practicing for such
So,
a long time. What is the change that you've seen?
I am in Belagavi since 17 years. So when I came, that is 2008, it was not that much availability of drugs or usage of drugs. That is now since 3 4 years, usage, that is especially after COVID, that usage of drug has become severe. Especially these narcotic drugs, heroin, brown sugar. That is the in Belgaum they will get pani. It's called pani,
Funny.
and it's very funny. And usually that is group of students, group of youngsters, they will gather and they will share among themselves. That is the
Okay.
common trend, even not only in this thing public, even in colleges. When they have leisures, they will go to some isolated places and they will start using this.
Oh. So, Doctor, what gaps still exist in the current research on teenage drug abuse, and what areas need further exploration?
Mm. See, that's what nowadays it is increasing. That use of drug is increasing. That is, we have to educate through education programs like this, or it may be drama by the health workers or NGOs. So we have to create awareness among the parents, among the students, or in the colleges, or in the villages. So then only that is these people will become aware and they will not use it.
What is your take for parents, Doctor? How do you recommend them to handle these things? Because most of them find it very difficult to handle these things. They don't
The
come out and
first thing
speak
is
about it. They don't come
first
out
thing is
to for medication for it.
they have to
So
observe, sir. They have to observe the children. Otherwise, nowadays, one or two children will be there. They have to observe where he is going, what he is doing. Even they have to keep watch on their social media also, what they are doing. So then only that is you people can control your children. Otherwise, it is very difficult.
thank you so much, Doctor. Thank you so much for spending time with us and creating awareness about drug abuse. We'll see you again. Thank you so much, Doctor. Thank you.
Thank you, sir. Thank you.